CSIRO are currently doing and are going to do in the future around aged care and healthy ageing in particular. As many of you know, Australia's got a looming health crisis. The joy of science over the last decades is that people are living longer. Unfortunately, they're not living so well. And the outcome is a cost to the economy to manage the chronic diseases that people now have in their later years. You guys as a group also have extremely high expectations for how the health service and how your doctors, your clinicians, your hospitals treat you in terms of the environment that they hold you in, the qualifications of the people that you deal with, and also the services and the tools and the technology that they should be providing you to manage your own care, to make your own decisions, and to age in a way that that supports you in terms of your health. So our aging population is causing the health system some stress, but actually the chronic diseases that we are now seeing, the current generation of older Australians, and in particular the generations to come, those that are now dealing with obesity issues in their 20s will still be dealing with those issues in their 60s, 70s and 80s. And so we've got a change in the population build-up. We've also got a reduction in the number of people who want to work in healthcare. We've got a lot of people who are now retiring, and so the number of retired Australians is going to overwhelm the number of working Australians and put even more pressure on the tax dollar. So CSIRO are trying to work with various health agencies in Australia and internationally to look at how we can get more productivity by using technology, get better services so people can manage themselves, allow people to stay in their own homes and manage their chronic disease, use technology to get an insight into their day and how they're doing, and then manage themselves accordingly, rather than as soon as you think you might have a temperature, popping down to your local GP and putting them under pressure. So that's really our remit. We know that rural Australians struggle with access to healthcare, and this is our second component. If you live in a remote area, you've got a smaller number of GPs, you've got a smaller number of specialists, you've got smaller clinics, they're more overworked, and so generally speaking, you end up going to the major cities for major care, which means you stay in hospital for longer because they're afraid to send you home in case you have a relapse, and then you'll only have the limited supplies there. So we're trying to bring services into the community through technology, through mobile apps, through telemedicine and telecare, so you could go into your local nurse specialist and actually talk to your cardiologist or whatever the surgeon is at the other end, rather than actually travel to the major cities. The first project that I'm going to talk about, and I think most of you probably heard about this one last year, so I will keep it brief, is our Smarter, Safer Homes platform. This is a technology that we've built in conjunction with people who live in independent living homes. My background is in human-computer interaction, which means I want to know what the need is from the end users of a piece of technology. What do you want it to do? How do you want it to do it? What should it look like? Should it make noise? Should there be buttons? Should there be, what should it do for you in order to get the value from it? So what should it enable you to do? Not what do the software companies want to deliver or what do the doctors want to put in your house, but really around what you want from a piece of technology that sits in your home. The Smart Homes, as many of you know, is a platform where we put sensors in your house. These are like the sensors that you see that are in security systems, burglar alarm systems that sit in the corner of your room, flash. We can put sleep sensors on your bed. So it's just a little device strapped to the side of the bed and monitors how many times you turn over during the night and whether you've had restful sleep or whether you've had restless sleep. And sometimes our doctors want to know if they give someone a new medication. Has it changed their sleep pattern? Do we see that they're sleeping longer, in which case maybe I've given them too strong a dose. We look at the number of times you're in your kitchen and what you're doing in there. So are you using the microwave and the kettle and the fridge? A lot of people's medication is kept in the fridge. And so looking at how many times someone interacts with their fridge during the day can be a proxy for knowing whether they've taken the medication or not. We have one family and the son can see some of the information that flows from his mother's house, and he watches her medication. She knows he's watching her medication, so she goes and she opens the fridge and she shuts it. And we love that. And she likes that he's watching, but she knows that, if she wants him off her back, she just goes and opens the fridge. Sometimes she'll take the meds, most of the time she does. And for her, it's a knowledge that he's watching, but he's not really watching, but she knows that when he phones that evening or video conferences into her app, he'll say, Mum, did you take your meds? And she can say, you know I did. You saw it. So that's the kind of technology that we're trying to empower. It's not about Big Brother and watching you. It's really about the small, simple things that technology can do in your home. And if someone wants to go missing or go for a walkabout, it could say, well, the last time they were seen in the house was at this time. If somebody doesn't get out of bed in the morning, the system can say they had a very restless night's sleep. Usually they get up by 7:30 or 9:30 or 11:30, whatever that person's norm is, and they haven't done it today. So potentially the nurse or family member could give them a call and say, are you feeling all right? Do you want someone to come down and look at you? Because it's a deviation from the norm. And that's what we're trying to do. We put humidity sensors in the bathrooms to see if people are showering and looking after themselves. And really what we're trying to do is not just look at the small things, but look at the big picture. Does somebody change over time? If we look at a 6-month period where someone was, in the shower every day, up bright and sprightly and out and about and seeing all their friends, and then 6 months later we see that they're not getting out of bed early in the morning and they're not leaving the house as often, or potentially they're not looking after themselves. What does that mean for their family, for the individual, and how do you talk to them about the changes that they're potentially going through in that period of time, without being too invasive and without giving too many raw details? Like, we'll never monitor to see where you are. One of the big things that people said to us, well, you can't put in the system whether someone came home at night, because it's their choice as to whether they come home at night. And so all of the things around your personal safety and security in the concept of what we're talking about are all very, very important to myself as the designer of these systems. This is a typical picture of the kind of data that you can get from a house. And this is just using the motion sensors in each room. So they're colour coordinated to show the bathroom is red, kitchen is blue, the lounge is green, and the bedroom is the purpley colour. So you see in the middle of the night, the only movement we're getting is in the bedrooms and the bathroom. And then as the day goes on, we see activity, so the person's out of the house at different times of the day. In the evening, primarily they're in the lounge. And then again, we see bathroom activities, so maybe this person has their showers in the evening and then retires to bed. So it's very easy to see deviation from the norm on a graph like that. So if I had a day where I had the flu and I didn't get out of bed, then you would see there'd be changes. So this person gets up about 6 o'clock, maybe goes to the bathroom and goes back to bed. So you can very easily see on a visual system for a nurse to be able to say, something's wrong, Norma's today, she's not up and about. Now maybe she had too many glasses of wine last night, who knows? But they can just see at a glance that potentially there's something not quite right. We see great data when someone comes to visit. We see more movement in the kitchen, tea's being made, the microwave's on, there's a cake in the oven, that kind of thing. And we can see the little pictures and snapshots of that. We made an iPad app for the people who live in the houses, and it shows them their data. So I can take my blood pressure measurement with my cuff, and it talks to my iPad, and the data appears on the screen, and it'll say, Jill, it's a bit high today, maybe you want to take it easy, or maybe if you're taking different medication, it can tell you. People often think they've had a terrible night's sleep. You think, I didn't sleep a wink last night, I'm going to have a really easy day today. And you can look at your data and say, actually, I was awake for about 10 minutes, 4 o'clock, and then I went back to sleep. So actually I didn't have a terrible night's sleep. But my perception of my health is often different from the reality, and that's kind of what this system is trying to do. And we'll look at, there's a camera there, so you can have a look at who's at your front door before you get off your couch. No, I'm not in. I'm not answering that one. There's a diary in there. You can video call your doctor, you can video call any family member, and so you get really rich communication between you and the other side. I live on the other side of the world to my parents and my nieces and nephews, and it's fabulous now to be able to sit and talk to them on Skype, and my nephew comes in and kisses the screen. And so you get really engaging conversation regardless of your age group when you work through video conferencing. We've got another really nice mobile project around cardiac rehab. So if you have a heart attack, if you're unlucky enough to have a heart attack in your life, there's a 40% chance that you're going to have a second one. So we know that one heart attack almost predicts another one. We also know that cardiac rehabilitation programs are really effective. But cardiac rehabilitation programs mean that you have to go in and out of an outpatient's ward into a clinic and have rehab in a public space with other people when you're really not feeling your best. Sometimes it's a drive to the clinic, sometimes you need to go back to work, sometimes you've got responsibilities at home. So what if we gave you a mobile app which helped you to do your rehab? What if we gave you an app that sent you text messages to say, now you need to do your 20-minute walk, or now you need to do this exercise or that, and you ticked off a little box that said done, and it goes back to your mentor, and they see that you've been complying with your program. And then once a week they'll phone and say, Jill, how are you going? This is what happened this week, this is what I saw from your data, do you feel the benefit? You know, do we need to reduce that? Can we increase the other? But you don't need to go anywhere. You have a 15-minute conversation rather than an hour's drive and a sit in a waiting room and somebody's late because they talk too much. This is, you know, a reality of a really simple, effective system. And because you know that phone call is coming at 4 o'clock on Thursday, you're much more likely to do your exercise than if you're completely on your own. So this responsibility of, oh, she won't be happy if I haven't done it, that's the reality. So we're trying to use the phone as a way of saying, no, I definitely did it. You can use the accelerometer in the phone to record your walking. So you can't just write in, oh, I did 20 minutes today. The phone will actually record some of that for you and keep you on track and keep you honest, I suppose. So the phone basically takes out the outpatient rehabilitation. And so it removes that need for it, and you do it all through your phone and you get your program. We did a clinical trial. It's the first clinical trial of a mobile app for cardiac rehab in the world. We saw more people say, yes, I'll do rehab. We had more adherence, so we had people do their exercises when they said they would. And we actually had more people complete. And currently we're in the phase where we're now waiting to see, well, did fewer of our participants have heart attacks? But the science that says that the cardiac programs are effective is already there, and so really we're just saying more people did their cardiac rehab and did it better when they did it through the mobile phone. The last one I have is around monitoring for chronic diseases. So a lot of people, when they get a chronic disease, will either spend a lot of time with their doctor, potentially move to a residential care unit, but there's generally a lot of upheaval in someone's lives, because when you have one chronic disease, chronic condition, you usually have multiple, so they don't usually come on their own. They tend to come in bundles and can be quite confronting. So we had a large trial last year, around Coachella, funded by the NBN Telehealth trial of the previous government. We were one of, I think, about 8 or 10 of these trials that ran across Australia. We had 6 different sites down the east coast of Australia. It was a beast of a trial to run. We worked with some aged care homes, some Medicare locals, some hospitals, some GP clinics, and we wanted to know if each of these institutions was to roll out telecare, what would they need to do? What training would their nurses need? What's the reality of putting one of the systems into somebody's home? So really not the technology, but the rollout. How do you effectively turn this on? There's lots of telehealth pilots in Australia. Some say we have more pilots than Qantas, but no one's actually turning this on as a real service that you can just go online and say, sign me up, I want in. So this is where CSIRO is trying to take this technology. So does the home monitoring help? Is a different model of care appropriate, and how might it work in the different environments?
The population is ageing. Those aged over 65 will double, and those aged over 85 will quadruple in the next 20 years. Chronic disease at present consumes over 70% of the total healthcare budget and is growing so rapidly that it could consume all of the state budgets within 20 years. Telehealth is one of the best ways of trying to reduce hospitalisation and therefore hospital costs. The telehealth system is basically a monitoring system with quite a large screen to help guide the patient through the different procedures. Typically the process takes 20 minutes. Patients take their blood pressure, they record their blood oxygen, their blood glucose, their electrocardiogram, their body temperature, their body weight, and they answer a number of clinical questionnaires. This data is then gathered and sent off almost immediately to a remote website to become visible to the care team. The data is collected in real time and can be viewed almost immediately, particularly if the patient is connected to a broadband system.
I monitor my clients once a day and looking at viewing all the data entries that have been transmitted to me. It is quite straightforward and it is a very easy process. I can see the information in real time. I can monitor them, following up with a phone call if there's any issues with their health. Your blood sugar level is looking a lot higher this morning. Also, with the time that has been freed up for me, I can look at that more new clients being referred to me.
The trial targets chronically ill patients that have complex chronic conditions that tend to take them to hospital multiple times a year. They begin to self-manage, and this is really important because this has been demonstrated to be very effective in helping to keep patients out of hospital. So the patients are a key player in the total management of their chronic condition.
I jumped on it straight away when May came to me and said, "Would you want to do it?" And there was no hesitation. Before, she was going to the doctors 2 or 3 times a week. Now she only goes once every 3 weeks. And with the help of this monitor, I don't get so scared anymore. Before, I was wondering if it's safe to leave the house, because many times I come home and she's been laying on the floor and she's injured herself, and it takes a lot of pressure off the GP. This way, you don't need to go down there if it's only something minor.
If telehealth is to be scaled up nationally, we need to have a way of being able to identify changes in patient health status on a daily basis. CSRO is developing some very interesting new tools to facilitate this and to allow nurses to understand the patient's condition on a day-by-day basis.
I can't thank her enough for what she's done for Janice and what the machine has done.
It's quite a powerful testimony from the guys. That one catches me. And it really is about self-monitoring and in the home. Fewer trips to the doctor, fewer days in the car, and that awareness and that safety net, which is today's going to be a good day. The data tells me so. Today's not going to be a good day. Let's do things differently and let's reconsider.